Why is cervical cancer screening follow-up vital? Have you ever wondered why following up on cervical cancer screening is so important? It's a crucial step in ensuring your reproductive health. When you undergo cervical cancer screening, tests like the Pap test or high-risk human papillomavirus testing can identify abnormal changes in your cervix. These changes could potentially lead to cervical cancer if not addressed. Timely follow-up ensures that any abnormalities are properly evaluated and treated, which is key to preventing cancer. One of the main reasons follow-up is vital is early detection and prevention. Cervical cancer usually develops slowly from precancerous lesions. If an abnormal result is found, follow-up procedures such as colposcopy, which is a detailed examination of the cervix, and biopsy can help healthcare providers detect and treat precancerous conditions before they progress to cancer. Another important aspect is risk stratification and appropriate management. Follow-up helps determine how severe the abnormalities are and the level of risk they pose. Current guidelines recommend a risk-based approach. For instance, minor abnormalities with a low risk of progression might only require monitoring with repeat testing in a year. However, higher-risk lesions may need immediate treatment or closer surveillance. Long-term surveillance is also crucial. Even after treating high-grade precancerous lesions, the risk of recurrence or progression remains elevated for many years. It is often recommended that women continue regular follow-up for at least 20 to 25 years. This ongoing monitoring, typically with HPV testing or cytology every 3 years, helps catch any new abnormalities early. Moreover, effective follow-up can significantly reduce cervical cancer mortality. By ensuring that abnormal screening results lead to appropriate diagnostic and therapeutic actions, we can prevent cervical cancer, which is largely preventable with proper care. Finally, personalized care is essential. Follow-up protocols may vary based on individual risk factors, such as age, immune status, and history of cervical lesions. For example, women with a history of high-grade lesions will need more frequent follow-up than those at average risk. In summary, cervical cancer screening follow-up is a critical step that connects early detection with effective prevention of invasive cancer. It ensures that abnormal results are not ignored but are thoroughly investigated and managed according to established guidelines. This approach is vital for safeguarding reproductive health and reducing the burden of cervical cancer. Always consult your healthcare provider for personalized advice and follow-up recommendations.